and I'm going to talk about lower versus traditional treatment threshold for neonatal hypoglycemia. Definition: neonatal hypoglycemia, defined as a plasma glucose level of less than 30 milligrams per deciliter in the first 24 hours of life and less than 45 milligrams per deciliter thereafter, is the most common metabolic problem in newborns. Major long-term sequelae include neurologic damage resulting in mental retardation, recurring seizure activity, development delay, and personality disorders. Some evidence suggests that severe hypoglycemia may impair cardiovascular function.
Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
Applications in medicine. We compare two threshold values for treatment of neonatal hypoglycemia. Newborns found to have asymptomatic moderate hypoglycemia between 3 and 24 hours after birth were randomly assigned in 1:1 ratio, with the use of web-based block randomization to receive treatment when the glucose concentration was lower to 36 mg per deciliter lower threshold group, or to receive treatment when the glucose concentration was lower than 47 milligrams per deciliter traditional threshold group. Participants were stratified according to study center and pre-specified high-risk subgroups.
Neonatal hypoglycemia is one of the most common problems encountered by the staff in the nursery after a child is born. It simply means that the baby's sugar is lower than what it should be. Now, generally, that's defined as something less than 30 milligrams per deciliter within the first 24 hours of life, or 45 milligrams per deciliter thereafter. If the problem is not detected and treated quickly, it can have long-term consequences for that child. There is a group of newborns that clinicians know will have problems metabolizing sugar. Specifically, children who are born of mothers with gestational diabetes. They've had a great deal of blood sugar coursing through their veins because the mother was producing that excess sugar while they were in utero. When that baby is born, suddenly that supply of excess blood sugar is cut off. But yet the baby was producing a lot of insulin to compensate and metabolize that blood sugar. Once the baby is born, it takes a while for the baby's system to realize, hey, we're not getting all of that blood sugar anymore, and we don't need all of that insulin to be produced. As a consequence, when that baby's born, it can have a dangerously low blood sugar level, and it needs to be corrected promptly, either with intravenous therapy or with a feeding. And it is important for those children to be monitored closely once they've had an abnormal level, because that's an indication to the clinicians that, hey, this baby isn't regulating very well yet. And so it is extremely important that the healthcare providers monitor the blood sugar level of the newborn. If you have questions about whether or not you and your child receive substance,
the pros are that the traditional group had less episodes of hypoglycemia, and the cons are that neonatal hypoglycemia often is asymptomatic. The lower threshold group included convulsions in one newborn and one death.
In neonates, hypoglycemia is common, and in severe cases it can cause neurologic impairment. But how low is too low? It's currently recommended that neonates be screened and treated when the blood glucose is 60 milligrams per deciliter or less. But recent studies suggest that blood sugars as low as 47 milligrams per deciliter are safe. Lowering the clinical threshold would significantly reduce interventions. But would it affect child development outcomes? The CHILD study was a prospective cohort study of 528 neonates born at 35 weeks or more of gestation and considered to be at risk for hypoglycemia owing to maternal diabetes mellitus, prematurity, less than 37 weeks gestation, and other factors. All subjects were monitored and treated to ensure a blood glucose of 47 or higher. 53% of them required treatment for hypoglycemia with a blood sugar of less than 47. The primary outcome was the developmental score on the Bayley-III test at the age of 2 years, as well as measures of executive and visual function. At 2 years, developmental outcomes in the children treated for hypoglycemia were similar to those in the children who were also at risk but had not reached a glucose level below 47. There were no significant differences in the Bayley scores on measures such as cognitive, language, motor, social emotional function, and adaptive behavior, or in the scores for executive and visual function. The authors conclude that neonatal hypoglycemia, when treated to maintain a level of at least 47 milligrams per deciliter, was not associated with adverse neurologic outcomes. Full trial results are available at nejm.org.
In Ecuador, Neonatal hypoglycemia is a frequent pathology that occurs as a consequence of poor management of maternal diabetes. It constitutes a major public health problem and one of the main causes of neonatal morbidity and mortality worldwide and in Ecuador.
The most important clinical point is to make sure that the patient is getting enough intake.
Healthy newborns with asymptomatic moderate hypoglycemia, a lower glucose treatment threshold 36 mg per deciliter was non-inferior to a traditional threshold 47 mg per deciliter with regard to psychomotor development at 18 months.
Be expected for newborn glucose concentrations to decline within the first 2 to 3 hours after birth. Transitional hypoglycemia describes infants who are inefficient at producing ketones, have lower amounts of fatty acid to utilize, such as small for gestational age infants, hyperinsulinemic, such as infants of diabetic mothers, large for gestational age infants or post-dates infants, and infants who inappropriately retain liver glycogen stores, such as in metabolic diseases. Neonatal hypoglycemia occurs in up to 10% of healthy newborns. The AAP definition defines hypoglycemia within the first 4 hours of life as less than 40. Hypoglycemia between the first 4 to 24 hours of life is defined by a blood glucose less than 45. This reflects the decline in serum glucose that normally occurs after the first 2 to 3 hours after birth. In contrast, the Pediatric Endocrine Society defines hypoglycemia within the first 48 hours as a blood glucose less than 50 and hypoglycemia as less than 60 beyond 48 hours.